Hi, my name is Dr. Janice. I am a general surgeon at Odessa Regional Medical Center, and today I'm going to be doing a talk about surgery in the era of COVID. So I just want to start that by saying I understand there's a lot of confusion, a lot of uncertainty about surgery in particular since COVID has been going on for this last year. In particular, I've had a lot of patients who I've seen at my office who are confused in regards to whether we are able to do surgeries and whether or not we should be doing surgeries. So just to start, we are able to do elective surgeries. So the government has gone back and forth a few times, first saying, first putting a hold on all elective surgeries, elective being something that the physician thinks in their discretion could wait, is not an emergency, just to clarify that. So the government has gone back and forth a couple times. Right now, for the past few months, they've been saying that it is okay to proceed. And the government is using statistics to make that judgment. So they look at how many cases of COVID we have in the area in particular and make sure it's below a certain number to make sure that the patients that we are operating on are safe when they go into surgery. So for the past few months, we have been given the green light to go from the governor. Additionally, I think now we are starting to go to or transition to an area where it is getting safer for patients than it was earlier on. So earlier on, we had more uncertainty. We didn't know exactly what trajectory the cases were going to go. However, over the past few days, and even in particular over the past few weeks, we have made significant improvement with our COVID cases nationwide, statewide, and locally. For example, nationwide, our COVID cases, new cases per day, have dropped about 40% in the last 3 weeks. So with that, that's giving us the sign that patients are probably going to be safer when they're coming into the hospital for any type of surgery. Additionally, now we have had the COVID vaccine that has come out. Not everyone obviously has been able to get to it yet, particularly people who are younger, people who have no comorbidities might not have had the opportunity yet, but we are starting to get a good percentage of the population vaccinated. Right now, we're up to about 9 or 10% of the entire population that has received the vaccine. Again, which just means we're going to have fewer people spreading it and less risk for people who are, might come in contact with somebody who has COVID. And then Steward in particular, I believe has a very good system in place that we use to make sure all the patients that we bring into the hospital are kept as safe as possible. So since the very beginning, Steward has been testing all patients before an elective procedure. So currently what we're doing is 24 hours before any elective procedure, the patients have been getting a COVID test. As long as that test remains negative, then they could proceed with the elective surgery the following day. If for whatever chance the patient comes back positive, which we do see on occasion, a patient could be positive without actually knowing that they have COVID or without having a known exposure or symptoms, then it becomes a judgment call in terms of whether or not proceed with the surgery. However, testing everyone beforehand, whether they have symptoms or not, eliminates any people without COVID of being exposed to someone who may have it. Okay. Additionally, sometimes we have to operate on people for emergencies who might have had COVID. The hospital has been making sure to keep those patients away from the patients who don't have COVID. Those are cases that are performed at the end of the day after all the otherwise healthy patients have gone home. So there won't be any interaction or close proximity. So you don't have to worry about potentially contracting it from somebody else. They have also been, ensuring that everyone who's in the hospital has been wearing masks 24/7. So you don't take it out at all, or you don't take the mask off at all while you're in the hospital. Again, decreases the likelihood of, somebody, transmitting it to one another. Also, there have been some changes a couple times with the visitation policy at the hospital. I know I've personally had a lot of patients who are concerned, if you're undergoing a surgery, that's a a big event, a stressful event, anxiety producing event. And for a long time, you couldn't have family members there with you. That has been tough for a lot of people. Now, over the past few weeks, that policy has changed. So now you are allowed to have a visitor again with you using elective procedures, for example. You're allowed to have a family member with you before the surgery. When you go off to surgery, that family member leaves the building, goes to their car, goes home, wherever. And then they call you when it's time to get picked up again. So now we don't have patients who, sometimes you might be having to wait, an hour, 2 hours before your surgery. Again, while it's a stressful time, at least now you can have a family member with you there again. It's a big step towards getting back to normalcy. Additionally, while we have all these, things in place to prevent people from getting COVID, while they might be there for an elective procedure, patients need to know that it's, postponing surgery. While for some people that might be the right decision, there are some negative effects of that as well. For instance, if somebody has, say, pain from gallbladder disease, okay? While it is understandable that some people are worried about catching COVID, the more we postpone things, the more troublesome that can be for you as the patient. Some people are having persistent symptoms where, they can't eat, they're constantly in pain. That significantly impacts your quality of life. If you were to, say, get your surgery done now, as opposed to a few months from now, that can get you back to your normal routine sooner, so you're not having as much time off of work and not having to go to the emergency departments or spending extra money on that and things like that. Now, I did get a question which I want to answer right now. Someone asked me what elective means. So from a surgical standpoint, we basically have 3 types of criteria that surgeries can fall into. The first criteria is emergent, meaning we have to do the surgery now, either within the next couple minutes to hours. Okay. The next step back would be urgent. We have a number of hours to a day to do the procedure. Anything beyond that would be what we would call elective. So elective would mean that postponing wouldn't cause significant wouldn't significantly increase your chance of dying from the illness. Using the example of a gallbladder, for example, if someone has gallbladder disease, there are people who have acute inflammation that need that surgery right now, today, or tomorrow. There are other people that it's definitely a nuisance for them. So they might have trouble eating, might be in mild to moderate pain, and they would benefit from having that surgery to remove their gallbladder, but they don't necessarily need it today. So those would be the people who would fall in the category of elective. And this isn't just for gallbladders. This would count for, for hernias, hemorrhoid surgeries, and anything like that. Additionally, if anyone else has any other questions, you are welcome to send it in, and I can answer those as well. So in addition to postponing it, and while it would cause significant, delay of care for the patient, again, potential trips to the emergency department, another thing to consider is sometimes with delaying surgeries, that can actually make the surgery more difficult itself. So again, using gallbladder surgery, for example, when the gallbladder is inflamed, it starts forming more scar tissue inside the abdomen around that organ. The longer it's kind of sitting in that inflammation, the longer that's going on, the worse that scar tissue gets. And we know from years of studying patients who have this, the longer your symptoms are going on and the more you have that scar tissue, the harder the surgeries are. You might be at higher risk of switching from a laparoscopic or robotic gallbladder surgery to the old-fashioned way with the bigger cut, which then means you might have to be in the hospital for a longer period of time. Additional question. Okay, so the question was, what elective surgeries and screenings should you not put off during this time, and why? So whatever a patient decides to do or not do, make that decision with the provider. So I always say, if you're in doubt about whether or not to proceed with something, just talk to your individual provider, whether it be me as a surgeon, whether it be your family physician, whomever. Talk to them about the individual, procedures. I do believe now that we have gotten to the point where, with all the measures we have in place, with cases going down, with the vaccine coming out now, that there isn't anything that I would tell patients to hold off any further. If you're still uncertain, then we would do that as a case-by-case basis. But there's no real strict rules for hold off A but proceed with B. So it's just open conversation individuals need to have. And then other than that, are there any particular questions people have? Any others? I'm not seeing any other particular questions coming out. I'll give people a couple minutes for that. It's a question, but it's giving me trouble scrolling, but so just bear with me. Yeah, so one of the questions I had is, what is considered minimally invasive surgery, and what are pros and cons to that? So with surgery, when all surgeries were developed, the easiest way to fix anything inside of the belly, for example, and this would apply to other specialties such as orthopedic surgeries, was with a big cut, so we could fix everything directly with our hands. If you go back 20 to 30 years ago, we started developing laparoscopic surgery. Basically, we make a few small incisions and then put a camera inside and use instruments to do the surgery that way. Excuse me. Now, since then, over the last few years, they've had a surgical robot, which has been able to assist us with these minimally invasive surgeries as well. And then just to kind of clarify some things people don't fully understand about the robot. So when people hear about the robot, a lot of people worry that it's a robot doing the surgery, which is not the case. The robot is a tool that allows me or another surgeon to do your procedure with its assistance. The best comparison I can kind of use is it's almost like a video game type controller. So we use the robot and put all the arms, so to speak, of the robot in, and then we use controls that can basically make my fine motor skill even more precise than it would be with my own hands. So that allows us to work inside with much better dexterity than we had even with laparoscopic surgery, which preceded it. That is where most of our surgeries are going now, to try to make things as minimally invasive as possible. In particular with gallbladder surgery. At ORMC, we do have a Da Vinci robot, which I myself prefer using for most of my surgeries. I have found that patients have less pain with the robot. They are back to work sooner with the robot and back to their normal life sooner. After any type of surgery, there's always going to be a post-operative period where you're recovering, but while being able to use that lets patients just get to normalcy as soon as possible. So I try to do everything that I can with the robot or laparoscopic, between those two. Another question is, what type of preparations can I expect before elective surgery? So before any surgery, what you have to do the day before will ultimately be up to the surgeon or the family doctor, internal medicine doctor who's seeing you beforehand, in terms of what they need you to go through beforehand. So different people, depending on the age, you might need a chest x-ray, you might need an EKG just to make sure everything with your heart is safe enough to undergo the surgery. If you have had problems with your heart beforehand, they might want you to see a cardiologist, just for the cardiologist to evaluate you, and again, make sure everything is safe before going to the surgery. Last thing we want to do is have a patient go for hernia surgery, gallbladder surgery, and if they have a heart that can't tolerate it, we don't want to put you through that. So we got to make sure everything is tuned up beforehand. Now, additionally, patients often have to get some kind of blood work done before surgery. Again, that is up to the individual physician in terms of what they would require. The COVID test that we are doing is being done that day before surgery with the additional tests you come in for. So we try to do it all at once so patients don't have to make extra trips and things like that. So while you're getting, potential chest x-ray, EKG, blood work, at that same trip is when we do the COVID test, which is done via a nasal swab. And also, just to clarify, the way we are doing it is to minimize contact with anybody as well. Because we're testing people for COVID, there's always a possibility some of those people may have COVID and we just don't know yet. So these tests aren't being done in the hospital. They're being done outside of the hospital while you stay in your car, and then they can give you that answer before you go in to get the rest of your blood work done and all that before you interact directly with the people inside the hospital. But we are doing that also the day before to try to minimize that interaction as much as possible.